Bismillah ar-Rahman ar-Rahim. This week's session is on the fiqh of fasting, the rulings of fasting. I'm going to go through this quite swiftly because we've got 45 minutes and there's quite a lot to cover. So just a quick recap from last week. Virtues of Ramzan. We have Ramzan coming very soon, the best of all months. It's a month of forgiveness. The shaitan are chained, the devils are chained, the doors of the fire of hell are closed and the doors of paradise are open. And it has a very special night known as the night of power. So as I mentioned, it's a month where the month of Ramzan arrives, the doors of mercy are opened. Fasting literally means to abstain. So in Islam, fasting means to abstain from food, drink, and intimate relations from the break of dawn till sunset. Fasting in the month of Ramadan is obligatory upon every adult, male or female, who are both physically healthy and also mentally healthy as well, and not a traveler. Because rulings regarding those that are unwell and who are traveling, etc., they have different rulings. Is it necessary to make intention? It is necessary to make intention because it's a farz act, it's an obligatory act. Intention does not necessarily have to be with the tongue, it can also be in the mind as well. So make an intention that Allah Ta'ala, I am fasting for your sake. That's why if a person stays away from all those things that a person needs to abstain from, without an intention, the fast will be valid because it's a farz act, and for farz acts, for obligatory acts, for obligatory deeds, for example, praying salah, an intention is compulsory. And I've already mentioned it's not necessary to make a verbal intention. The intention can also be made from the heart, which will suffice. Some recommended acts to make intention at night. To partake of the suhoor. The suhoor is a pre-dawn meal, and there's a hadith which mentions that a person who takes the suhoor, who eats a pre-dawn meal, angels actually, they ask for forgiveness for such a person to the nearest meaning. To break the fast immediately after sunset, obviously making sure that the time for iftar and the time for breaking the fast has commenced, and to break the fast with either dates or water, whichever one is available. Some disliked acts. Now I'm going to come on to a slide where we go through those acts which actually invalidate a person's fast, but which acts are undesirable. They don't break your fast, but they do decrease the reward of the person's fast. To chew gum or rubber or any such item, to collect one's saliva in one's mouth and then to swallow in order to quench one's thirst. If a person has become impure due to whatever reason, Islamically impure, then to delay a bath intentionally. To use toothpaste. I mean, nowadays there's a big kind of concern. A lot of people can't do without brushing their teeth with toothpaste. See, the problem there is with toothpaste and mouthwash. If the toothpaste or mouthwash is to go down a person's throat, which is the likelihood, then a person's fast will be invalidated. Hence, the scholars, they mention that it's better not to brush your teeth with toothpaste or use mouthwash. Obviously, with miswak, a person can use miswak and clean their teeth. So a person should have that ready, maybe have that purchased prior to Ramzan. And obviously, the reward from miswak is much more than just brushing your teeth with toothpaste. To complain of hunger and thirst, and also to put water into the nostrils too much, because we're going to come to that in a minute. To gargle more than necessary, and also to gargle, to quarrel and argue and use filthy words while the person is fasting. Although that will break a person's fast, but it will decrease the reward immensely, because the whole point of fasting is to abstain from food, drink, intimate relations, and more especially abstain from sins, so that we can attain piety during this month. So if the fast is invalidated for whatever reason, there are a few things which a person may need to do. So there's some reasons where a person needs to only make up doing qaza. So you keep one fast in place of the fast that's been missed, and in other situations, kafara becomes necessary. In other situations, kafara becomes necessary. Kafara means that you keep one qaza and you keep an additional 60 fasts. So that's 61. In some situations, a person has to keep 61 fasts. And we're going to find out why, hopefully, in a few slides. And also, during the kafara, if a person misses one fast in between, then he or she would have to start all over again. So the criteria for breaking one's fast, just to give you a bit of understanding. So what are these rules kind of based upon? So in the Hanafi school of thought, the one that we follow, if anything reaches something that has a perceptible body, that if they reach the brain or stomach, it will invalidate the fast. And also if they reach the body through a normal opening, such as the mouth, nose, front and back of the private part, in them circumstances, the fast can break. So what we understand from here is that that which enters the body and reaches the stomach or the brain, the fast will invalidate. And also if it enters any of the normal openings of the body, then also the fast will be invalidated. Obviously, there are exceptions, which we can discuss later on. So let's have a look now. Those reasons where only qaza is necessary. So basically, you've missed one fast of Ramadan, for example, and after Ramadan, after the month of Ramadan, one fast will become necessary in place of the missed fast. Okay. What you've got to remember also is that, missing a fast for no reason is a major sin, or breaking it for no reason, major sin. The hadith mentions that even if a person was to fast for his or her entire life, they would not be able to make up for the virtue of the fast that has been missed or broken. So let's have a look now. So the mouth and throat, eating or drinking accidentally while a person is conscious of the fast. See, there's a difference here. One is that a person eats forgetfully. But if a person eats accidentally, then only qaza becomes necessary. So a person knew they were fasting and something basically slipped down the throat, okay? Eating or drinking because one thought that Maghrib Salah had entered and Maghrib did not enter. Eating or drinking because one doubted that Fajr entered, but really Fajr did not enter. Eating or drinking forgetfully and thereafter thinking that the fast is broken, so then a person deliberately then starts eating again. Okay, swallowing a pebble or other items that people wouldn't typically eat. Okay, swallowing water by accident. For example, a person was sitting down for wuzu, they knew they were fasting, and accidentally water went down the throat. Would the fast break? Yes, it would. It would break because the person was conscious of the fast. Swallowing blood that exits from the gums and is more than the saliva, and this ruling same for the wuzu as well. Swallowing toothpaste or mouthwash, deliberately swallowing vomit that reaches a mouthful. So a person vomited and reached a mouthful and swallowed it back in. Vomiting and thereafter thinking that the fast is broken, then a person deliberately vomits again or eats and drinks again. this also will necessitate a qaza, and a person would need to keep one roza in its place. If you guys have any questions in the meantime, please don't hesitate to ask in the chat. Regarding the nose, I did say openings, any natural openings of the body, if anything goes through them, then in certain circumstances, the fast will break. So regarding the nose, a person is doing ghusl or doing wuzu, conscious of the fast, and water goes inside the nose and it goes to the brain or throat, then the fast will break. Inhaling medicine into the nostrils, that will also break the fast. Inhaling smoke by one's doing, on the condition one's body doesn't benefit from it. So basically, you were passing by, for example, and somebody was smoking, and so if the smoke was inhaled deliberately, then the fast would break. I was going to mention here, right? Yeah, we'll come to that at a later stage. I will talk about the asthma pump later on. Okay, so those were those reasons why a person would only do qaza. Qaza meaning keep one fast in its place. The following will make both qaza and kafara necessary. So basically, in essence, for missing that one fast, a person would have to make up having fasted for 61 days, 2 months and 1 day. 1 day for the qaza and 2 months for the expiation, which is known as kafara. So in principle, if a person breaks his fast in Ramadan without a valid reason, through eating, drinking, or engaging in intimate relations, then he will have to make up the broken fast after the month of Ramadan and also observe kafara, which is 61 days. And I'll also mention later on that it doesn't matter how many kafaras have taken place, only one kafara, so 160 days, 160-day portion would suffice for all the kafaras that have been made for that Ramadan. So kafara can be observed, right, in many ways. The primary way is to fast 60 days consecutively. If the 60 days for fast are not kept consecutively, then you need to start all over again. Obviously, if there's a natural reason a woman is in her monthly menses, then that won't break the continuity. She can carry on once that has ended. If a person cannot fast for 60 days, then to feed 60 poor people 2 meals a day, or one person 2 meals a day for 60 days. But again, feeding poor people would be again in specific circumstances. If a person is capable of doing the first, a person would not be allowed to do the second option. The second option would only be valid for people who are not able to do the first option. And it's also a misconception that people think, well, I can't fast the 60 days of Ramadan in the summer. The fasts are too long. Then what a person should be doing is trying to fast in the winter. The fasts are shorter. If the person can fast in winter and do the 60 days, then a person would not be allowed to go on to option number 2. Option number 2 would only be allowed when a person is incapable of doing option number 1. A question that may arise: a person intentionally broke his fast 3 times in the month of Ramadan. Now, so he's basically got qaza and kafara. He's got 3 qaza and he's got a kafara as well. So does this mean that the person will have to fast 3 days for the fast he broke and 180 days as kafara? The answer is no. As I mentioned before, that one kafara would suffice for all the fasts that have been broken, 160 days. And then obviously the 3 days that he or she broke their fast. Okay. Which acts do not invalidate one's fast? So eating or drinking forgetfully. There's a hadith narrated by Hazrat Abu Hurairah radiallahu ta'ala anhu, that whoever forgets he is fasting and eats or drinks, let him complete his fast, for it is Allah subhanahu wa ta'ala who has fed him and given him to drink. Narrated in Bukhari. So if a person eats forgetfully, then the fast is not broken. Swallowing one's own saliva, again, will not break one's fast. Obviously, to do that on purpose to quench one's thirst is makruh. If a person sniffs up their own mucus and it descends in the throat, that won't break the fast. Inhaling smoke or dust unintentionally. Starting the fast in the state of major impurity, that will break the fast. Nowadays, we have the issue with COVID injections. Would COVID injections break the fast? The answer is no. Inject any type of injection, blood transfusion, kidney dialysis, glucose or saline drip will not break the fast. The exception is that if an injection was put directly into the stomach and there was some kind of nutrition in there, then that could break the fast. A blood test or cupping or any form of blood extraction would not break the fast. Obviously, it's disliked because it can make a person weak, and all that goes same for the COVID injection. The COVID injection has a likelihood is that it has some side effects, and those side effects would actually it would affect the person during the fast of Ramadan, during fasting. So it's better to delay the COVID injection until after Ramadan. Tooth extraction on the condition that blood is not swallowed. And that goes same for going to the dentist. If the dentist is going to perform a procedure where a person may swallow blood, then dentist appointments should also be delayed until after Ramadan. Inhaling air through continuous positive airway pressure or inhaling oxygen, as long as it's not combined with any other substance, that would not break the fast. So an example would be a person is on the ventilator and is inhaling oxygen. As long as nothing is mixed with oxygen, the person's fast would not break. Using a miswak or toothbrush would not break the fast. Toothpaste should be avoided, which I've already spoken about. Swimming or submerging the body in water would not break the fast. But again, with swimming, a person needs to be very cautious because the likelihood is that water would go into the mouth. Tasting food would not break the fast. Obviously, it's makruh. And the scholars say that if a person has, if a spouse has such a husband who has a bad temperament and does not like, how would you put this? I mean, untasty food, has very concerned about how much salt goes into the food, then the wife has a leeway of tasting the food to make sure the taste is right, but then basically tasting and spitting it out straight away. Okay, nicotine patches will not break the fast. In the same way, pain patches will not break the fast because nothing's absorbed into the stomach. Okay, who are exempt from fasting? A traveler is exempt from fasting, and they will make up the fast after Ramadan. It does not mean that they don't fast. They can fast if they want. Okay, and also there's a misconception here as well. I mean, people think that, for example, I'm going to Pakistan. The flight is at 5 p.m. in the evening, and a person is still in his own locality. So are they classified as a traveler? The answer is no, because they're still in their local area. They're not classified as a traveler. They'll be classified as a traveler once they sit on the flight at 5 p.m. So a person would not be allowed to not fast in the morning. They should fast. And once they become a traveler, they should continue the fast if they can. And if they think that the fasting will be too hard while they're traveling, then they're allowed to break the fast without a kafara. Only qaza will be necessary. Okay, a sick person will make up, or if long-term illness, then will give something called fidya, which we'll come to in a minute. This is all being derived from the Quran Kareem, the verse in the Quran Kareem, where you can see on the screen ayyam ma'dudat. What is fidya? Fidya basically is a certain amount that is given in place of fasting, as long as the condition remains chronic, such that a person cannot fast either in Ramadan or make it up later. Even in the winter months, a person is unable to fast, then they will continue to give fidya instead of fasting. Now, the fidya amount actually it differs every year, or every now and again. It fluctuates. The fidya amount is the same amount that a person gives at the time of Eid for the Eid al-Fitr fidya. So basically, giving that amount 30 times, times 30, that would be the fidya for the whole of Ramadan, and one fidya per fast. Again, a person should ask their local scholars to see what the current amount is. However, if the condition improves in future, even after giving the fidya, by the will of Allah Ta'ala, then and a person is then able to fast, then he should make up those fasts by qaza, even though the person has or she has given fidya. The fidya amount is the same as sadaqatul fitr. I mean, it's around about £3. I think this year it's about £3.50. I'm not 100% sure. Again, a person should ask their local scholars. Some frequently asked questions. Vomiting. Vomiting only breaks one fast if one returns and swallows the vomit down the throat, or one vomits a mouthful intentionally. If one's fast is broken by vomiting, then one will only have to make up qaza. There's no kafara. Kafara will not be necessary. Vomiting does not break by non-deliberate vomiting or deliberately vomiting less than a mouthful. Hazrat Abu Sayyid Khudri narrates the Prophet said, 3 things do not break the fast of a fasting person: cupping, vomiting, and a wet dream, which is narrated in Tirmizi. How does one decide when vomiting is a mouthful? So the definition for that, mouthful vomiting, is that one finds it difficult to hold back the vomiting. A person vomits a mouthful to such an extent that it's difficult to hold it back. That would be classified as vomiting. Another question: little amount of vomit went up my throat, then as a reflex action, it went back down. I felt I had no control over it. Does my fast break? The answer is no, your fast will not break. Can a person swallow the food left between their teeth while fasting? The answer is if a person fasting swallows something which was stuck between his teeth from before the beginning of the fast, then the answer is we'll have a look. Is a particle smaller than a chickpea in size, then his fast will be deemed as valid. However, if it's equal or bigger to the size of a chickpea, then the fast will break. Kafara will not be necessary. However, if the food is then taken out of the mouth and then swallowed, then it doesn't matter what size it is, whether it's the size of a chickpea or more or less. In all circumstances, a person's fast will break, regardless of the size. Do eardrops break or eye drops break one's fast? The answer is eardrops and eye drops do not break one's fast. Although there are some scholars who say that eardrops do break the fast, but as scientists, according to scientific research, there's no kind of passage between the ear and the stomach. Hence, a person's fast will not break. What about tooth extraction and dental treatments? I've already explained before, provided that the water, blood, or any other liquid which the dentist is using does not go down the throat, the fast will not be invalidated. But again, that I think to be on the cautious side, a person should make them kind of appointments after the month of Ramadan, not during fasting hours. I mean, the fasts are long nowadays, so it's probably going to have to be after Ramadan anyway. Does a nasal spray break one's fast? If a person uses a nasal spray, his fast will become nullified. The reason is because there's a passage from the nasal cavity into the brain. And I did say anything that reaches the brain will break the fast. If it's possible through consulting the doctor for you to apply the same medication by means of a cotton swab or to the inner lining of the nose, in this manner, the medication will not go beyond the nasal tissue. And obviously, the swab needs to be dry as well. What about deodorants and perfumes? So in principle, if any substance that has a body is passed down one's throat, then it'll break the fast. However, if such a substance goes down unintentionally, then it will not break the fast. Same goes for smoking as well. If you're passing by, somebody was smoking and you inhaled it, not on purpose, not deliberately, then the fast won't break. Aerosol sprays have a defined body. You see, when you spray, you actually see the spray in the air. So due to it having a body, the vapors contained in the aerosol, the fast can break. Okay, if one is not cautious while applying these sprays and it goes down the throat, it will break the fast. However, if someone else is spraying and the vapors go down the throat, as long as you didn't have an intention to take it down the throat, the fast will not break. Smoking cigarettes, shisha, and other similar items break the fast. A person will have to make qaza and also observe kafara as well. Regarding injections, I did mention that injections anything that's injected into the body, as long as it's not injected directly into the stomach, it will not break the fast, because it goes into the bloodstream. It doesn't go into the brain or doesn't give any kind of nutrition into the stomach. An asthma pump. Using an asthma pump while fasting will invalidate the fast, since it passes medication through one's throat and particles of it reach the stomach. If a person requires the use of an asthma pump and he uses it, then only qaza will be necessary without any kafara, because it's a necessity. And due to necessity, there'll be no kafara. If a person is not able to fast at all without using an asthma pump, then he may use it while keeping a fast and perform a qaza of those days where he was unable to maintain or sustain the fast. So that's why when he's fasting or when she's fasting, an asthma pump is not allowed. But again, a person will not have to make kafara, just qaza, which can be done at a later stage. And if a person obviously is unable to fast at all, then fidya can be given. Okay, can we close this session here and can we join again, please? Jazakallah.